Lizzie O'Leary in Washington with us, who's been covering the Senate vote. So welcome to both of you. Jeffrey, great to have you on set. Let's begin here. First, your thoughts on the likelihood the House and Senate bills will reach compromise and what the final legislation might look like.
I think they will reach compromise, but there's going to be a tremendous battle to be undertaken in January when they return, because there are a lot of the Democratic swing votes that they were able to obtain in the Senate that are very steadfast and locked in against some of the things like the public option or in favor of the public option. So they've got a lot of work to do before we see a final bill.
Jeff, I want to ask you about one thing that hasn't gotten a tremendous amount of attention yet, and that is the idea of a medical loss ratio, basically how many cents of every premium dollar insurance companies are going to have to spend on care. In the Senate, we see it at 80, 85 cents. Does that impact insurer profits down the road, do you think?
Down the road it will, but it's a very excellent point that people have really overlooked. Down the road, it definitely will have an impact. But right now, the insurance companies are rallying in the marketplace because the people who are going to enter this new market, 31 million people, some of them have got health issues, a lot of them don't. Yes, pre-existing conditions will come into play, but for you, the normal American who has health care coverage right now, your insurance rates are going to go up and your insurance rates are going to go up dramatically. So the government's not only going to get this from tax dollars, they're also going to get this from raising the premiums on the healthy people.
So at the end of the day, do the health insurers stand to gain or lose?
Oh, and they stand to gain. That's why their stocks are rallying. At the end of the day, they're going to gain a lot, and it's unfortunate because you wanted the public option in there to be able to compete against them, and right now it's not. And I think that's going to be one of the biggest battles when they return in January. Insurance companies right now have got a free ticket. Yes, they're going to pick up 31 million people, and yes, there's going to be no pre-existing conditions, but if you're a healthy American right now, this is bad news for you because your health care premiums are going up, your tax dollars are going up big time.
Well, that brings us to one of these questions about whether these bills actually bend the cost curve. There are a lot of cost containment mechanisms and more in the Senate bill, but do we know yet whether we're going to start to see health care spending come under control a little bit?
I don't think you're going to see health care spending come under control at all. You've got the rapidly aging baby boomer population, which is already out there. You spend the most health care in your last years of your life. That percentage of the population is going to ramp up dramatically. You've got 12.6 million people in the past 3 years who are denied coverage because of pre-existing conditions. That's certainly going to have an impact going up. And for the doctors, you know, you have a hard time finding a doctor who likes this. The American Medical Association endorsed it. But if you talk to doctors, our survey says 8 out of 10 doctors do not like this at all. All of a sudden, you've got this condition, cancer, and the doctor's being given why to treat you for cancer. Well, is that doctor getting $300 or $500 per patient going to be more incentivized or less incentivized to spend time with you when he's got more patients coming through? The patient care quality goes down.
Jeff, how much is this baby going to cost? We've got $1 trillion in the House, $871 billion in the Senate. What do you think?
Not even close. I think you're going to be close to 1.5 times the 871. You're going to be closer to 2 times the 1.2 trillion. This is the kitchen gone out of control. As you get people utilizing more health care, unfortunately, the costs are going to go up, and you're not going to see the long-term benefits for a long period of time. And basically, this is going to be like the kitchen remodeling job. It's going to be far more expensive and take a lot more time than anybody thinks. And if you've got health care insurance now, great, but the bad news is your premiums are going to go up a lot. If you're a taxpayer now, bad news is your taxes are going to go up a lot, and it's just not good news.
Jeffrey, I want to interject. We do have some breaking news. You mentioned those healthcare stocks rallying. Well, the Dow Jones Industrial Average, I want to redirect you guys to the markets for the Dow Jones Industrials right now at a 2009 high. Let's see if we can pull up that level. Dow Jones Industrial Average with healthcare stocks on the rise today, hitting an all-time high, a 2009 high. A high for the year, 10,512. Gain right now 46 points or 0.4%. In addition to those healthcare stocks rallying, you've also got good economic news. Today, initial jobless claims came in weaker than or better than expected, a lower than forecast print on the initial jobless claims number. And then durable goods orders came in lower than expected, but still showed a gain. So good news on the economy there. And we're going to continue discussing healthcare reform bill with Jeffrey Kraws after a short break. Much more with us. Stay tuned. Bloomberg News continues.